insightful edition of HealthAfrik on AAU TV. My name is Bridget Denteh. Today we're talking about mental health challenges and barriers to treatment in Africa. And you can watch us on Facebook and on YouTube on Association of African Universities Television. And you can follow us on Twitter, AAUTV_67. Before we go into the questions for today, I'd like us to share a few facts on what is happening in mental health in Africa. And one of the things happening is 60% of youth between 50 to 35 years form majority of patients at the Accra Psychiatric Hospital. The rising rate of mental illness among Ghanaian youth. And then treatment gap stands at 98%, meaning that for every 100 people that suffers mental health, only 2 people may receive treatment. That must be alarming to you. Okay. Yes. So we'll go on a short break and we'll be back. When we come back, I'll introduce my guest to you. We'll be back shortly. Please stay tuned. You're welcome back. As I said before the break, we're talking about mental health challenges and barriers to treatment in Africa. I'd like to introduce my guest now. With me here in the studio is Ms Masha Boi Bashiru. You're welcome.
Thank you.
She's a clinical health psychologist. And I also have Georgina Owusua Bonsu Bediako, right?
Right.
You're welcome.
Thank you. Thank you.
It's very nice having you on the show. And she is a clinical health student at University of Cape Coast. You're welcome.
Thank you. Thank you.
Okay, so before we go into the questions for today on challenges and barriers to treatment in Africa, I'd like us to talk about the facts that I put before we went on the break.
Right.
And it said that it's estimated that of the 21.6 million people living in Ghana, 650,000 are suffering from a severe mental disorder. What's your take on these figures? They are alarming, and I don't know if people are actually aware that they have mental disorders. What do you think about them?
Thank you for your question, Bridget. It's quite alarming to hear such figures, because what it means is that when we have 4 people in the room, at least one person would have had a mental health problem or would have encountered a mental health crisis. So first of all, what people need to know, a lot of people don't know that it's a mental health problem. Okay, so what people need to understand, that there's a difference between mental health and what mental health illness is. Okay, so with mental health, it's just your total well-being. Okay, how you feel emotionally, psychologically, how you're able to cope with life, with stresses, how you're able to put up your best abilities to perform in the community. So that's your mental health. Okay. On the other hand, mental health illness, okay, it's a broad term. So you have conditions that affect the way you think, the way you behave, and the way you feel. Okay, so what people need to understand is that it has no respect of age, gender, whatsoever. Mental illness can happen to everyone. And it was just recently that was published about 66% of people who have a mental health crisis. Okay, so mental health is one of the leading causes of health crisis. Okay, and it's estimated that depression will be the #1 by 2020. So what it tries to tell us that people are not aware, people are ignorant, people are having poor knowledge about their mental health problems. So having such conversation will help us to make people be aware of mental health problems and help people understand that there's a difference between having a total or optimal mental health and having mental health illness in general.
Okay, so what do you also think?
I thank you for your opportunity. I think it's a serious issue. Not to have knowledge of something, first of all, is the beginning of the whole problem. Yeah. So the main problem has to do with having the knowledge of what it is. Okay. And then once you have the knowledge of it, then you are at the beginning of solving the problem. Or if you don't have the knowledge of it, then you would have the statistics going up each year.
Yeah, that's also true. And another thing here is the treatment gap stands at 98%, meaning for every 100 people that suffers mental illness, only 2 people may receive treatment. Yeah. That is very, very bad. 98% and just 2 people are getting treatment. Then it means the whole country is,
a specific case.
Yes.
It's true. But we don't have to forget the fact that there are different mental health problems. Okay, so we have those who have the psychiatric basis, so they will receive a psychiatric help, and we have those who receive psychological services. So I think we need to be cautious when dealing with people who are receiving care. Okay, another thing also, a lot of people, because of the nature of the problems, like to stay anonymous. So there are certain statistics that is very difficult to get. So it's true that the number of people receiving care is not adequate, but I can say from where I'm standing from, people are becoming more aware of the psychological problems. So yes, they do seek psychological help.
And then there's also another thing, that lack of funding. And in fact, just 1% is dedicated to mental health in Ghana. So definitely people will not even come out with it. Yeah, that's also another thing.
It's a very big problem, because it was just recently that they published we lose about 7 to 9% of GDP to mental health problems. So if we are able to put so much funding with private corporations, with government stakeholders coming together for a sustainable goal of promoting mental health, we reduce the burden upon people and people become more productive, because you mentioned the people between the ages of 15 and 35 happen to be in the psychiatric hospitals. Okay, it's very alarming, because this is a very productive group of people who should be working and contributing their quota to the communities. But this is the case. These people are struggling with crisis. And it isn't to say that there's no help. There is help for people out there. People need to know there are psychologists, there are professionals who can provide this help. But people are not aware that they can get help for their mental health problems. That is the issue. Another issue is the stigma that is attached to mental health problems. A lot of people think seeking psychological help means you are mad, in quotes. Okay, so this is how it affects help-seeking behaviors of people. So we need to educate people to understand there's a difference between madness, let me use the common word, and having a mental health crisis, because mental health comes in different levels. They come in different severity, from the mild to the moderate to extremely severe. So depending on your level of coping skills and how much of that mental health affects you will determine what kind of treatment you need or what kind of help you require. So this is, I think that's basically why we have this treatment gap between people also not everyone would like to be associated of going to, psychiatric hospitals. So it's a big issue because we haven't departmentalized where psychology services will be and where psychiatric services will be, because some crises are not severe and therefore require psychological help. Okay. But however, how many psychologists do we have in the hospitals? So some will be compelled to go to a psychiatric hospital, and you wouldn't want to be suffering from a very mild crisis and going to a psychiatric hospital because they will assume you are going mad, So this is some of the things or challenges that we have as a whole in Ghana and Africa, I believe.
So talking of psychiatric help and psychological help, there's also spiritual healing centers. Yes, definitely. There are prayer camps who claim they actually save people or deliver people from their madness. What do you think about that?
For religion and psychology, it's a whole broad topic on its own. I should mention that. And religion and spirituality is part of human life. You can't take it away from them. For some people, it has worked for them. For others, it haven't. So you can't bring it down that it's not good or you're taking it out, because it's part of the people. For some people, it's working for them. So you can't talk much about it because it's on individual basis. It's an individual level. You can't do much about that. People have the right to seek healthcare from places where they desire. Healthcare services is on the patient's level. It's the patient who decides where I want to have my healthcare. But when you give them the knowledge of where is best, then they make the choices themselves.
And my last fact for today, the passing of the mental health bill, and then the fact that every mental health patient still has a right. So does that mean that the madman on the streets has lost his right for protection or something?
It's maybe from fundamental human rights. At a point in time, yes, it's true that person would lose his rights, but there's a limit to what the person can lose, because that person will have distortions in the way the person thinks, how the person can contribute to society, what the person feels, how much the person can do. So there will be a limitation of someone like that, but that is not to say that such people will be discriminated. Mental health is not something to look down upon. There, as I mentioned, there are severity of it. So when the person becomes disabling in an area, the person needs to seek help in order, but that doesn't take away the rights of it. As a citizens of any country, it doesn't happen that way.
So what can then be done? Because they are on the streets and they even scare people, and they have rights.
For those ones, there's a law that governs everybody. You can't just go for somebody from the street and say, I'm taking you to the mental health hospital because I think you are having a problem. The person must have family members. The person is coming from somewhere. So maybe, I don't know, the best we can do for them, I actually haven't considered anything, but if there are families, like families should look for their people, families should get them to the hospital, families should be concerned about what happens to their people, because if you don't care for your sick or for your sick family member, then you don't care for them.
For some, I'll also just add to what Georgina mentioned earlier. It's that some people are on the street not because we don't have the right to pick them up. They're on the street because they want to be on the street. Some of those people you see are actually having a normal level of functioning. They are patients who were already in the various institutions who have, found their way to escape onto the streets. Some actually pretending to be one because that's the easiest way to make money on the street. That is their belief. So it's not the fact that nobody cares about these people. We also have less of infrastructure to house people like that. So it all goes back to the budgeting of what you mentioned. It's something we lack in our country. So we are hoping that using this medium or the platform, the investors and the stakeholders can listen to the plea and listen to the numbers that is happening to us so that we can take a step in the right direction.
All right. Thank you very much, Masha. So we are going into the questions for today, and I'd like you to share with us some forms of mental health and the causes of such.
Okay, so I'll just take a brief of it to see. When we use a statistical manual, every practitioner has their own. So the medical ones have, medical psychologists also use this. So when you look at it, we have over 300 mental health problems, okay? Wow. So they have all been grouped because they are conditions. So they've been grouped into clusters. So we can look at it, because you mentioned what are some of the causes. We can look at genetics. Okay, we have genetic condition, for example, Down syndrome. Okay, it's a genetic condition and it falls under mental health. We also have environmental things that might influence someone to develop a mental health problem. For example, trauma or stress-related conditions. For example, acute stress disorder or post-traumatic. They all fall under that category. We also have, so by mentioning this, it means I'm giving you the cause and a group of conditions just together. We also have the biological ones. Okay, so these ones are something that have to do with the central nervous system, the brain function, your motor coordination, speech and language. So we have children who have language and speech problems, okay? We have adults who have language and speech problems. And I think the last but not the least is what people don't realize, that habits can actually cause mental health problems. Habits, your daily habits. Excessive smoking, excessive drinking of alcohol, you know, desire for ecstatic drugs, you know, to feel good, mixing of all the substance abuses. So these are all come as a form of mental health problems. So even though a lot of people don't realize it's a catalyst to other mental health problems. So this is just an overview of some of the mental health problems. So the depression and anxiety that usually had, they are cluster of conditions. So they all come under mood disorders. We also have attitudinal disorders. So we have people who are deviant, you know, deviant children and all. You might think it's just, you know, the child is spoiled and all, but it's actually a condition which requires psychological help. So these are some of the mental health conditions that we do have across. Yeah, as I mentioned, there are over 300. There are over 300. We can't talk about all of them, but we can just highlight on the few of them.
So what are some of the treatment options for these mental illnesses?
Okay, so we have the part, the medication part, where everybody seems to know already, and we have the psychotherapy part. The psychotherapy, it's a whole
collection of therapies that are administered to the client. And also what Georgina wanted to also mention earlier was that there's no one size fits in all. You see, so it's an individualist approach to a client's problem. So even though two people might be having anxiety, for example, the sources of the anxiety or the cause of the anxiety might be different. So you cannot say this therapy is going to work for both of them. But universally what happens is that the first stage is self-help. Okay, so self-help are just, you know, attitudinal changes that one has to make. Have enough sleep, eat well, you know, take care of your body, have good relationship with people. So that's like having a positive feeling or adding a positive touch to whatever happens to you. Now, another one, we have psychotherapy. So this is a psychological approach to dealing with mental health problems. Okay, so there are quite of them. We have the cognitive therapists, we have the behavioral therapists, we have the dialectical therapists. So there are quite many for each in particular condition. Then the last one that she mentioned about the medication, it's actually a last resort for a mental health problem. And this is usually handled by psychiatrists or psychiatric nurses. So they have their procedure or how it's done. So psychologists usually would refer when the case becomes, or there's a need for a psychiatric evaluation. So it's a multidisciplinary approach to dealing with mental health.
So and that actually means that if someone is sick with mental illness and then you give the person medicine, the person can also take a psychotherapy, something, or you just do one for each person. Or like
Thank you. So let me just clear some confusion for you. Okay. So very first step happens is that when you go to a hospital, you should be cleared of medical conditions first. Okay, because there are certain medical conditions that they serve as a catalyst to mental health problems. Okay, so for example, somebody having diabetes, somebody having chronic pain might start developing anxiety, might start developing depression, might start developing stress. Okay, so this is just an example. So what it means is that you need to be cleared of all medical conditions first. The second procedure is to have a psychological evaluation. So if the person does not require medication on psychological level, the person will not be referred to a psychiatrist. There are people who require both psychotherapy and pharmacotherapy. So the pharmacotherapy is what they will be dealing with a psychiatrist with medication. So it's not a choice for a person to say, I want to take medication or I want to have a therapy. It's a matter of having the best treatment for that client based on the client's needs.
Yes. That's true.
Quite complex, isn't it?
Yes.
Exactly. So mental health doesn't have definite answers. Mental health doesn't have a specific flow. So it is very important to have such conversations so that people do understand that mental health doesn't look as easy as they think of having just to see a mad person on the street. Mental health goes deeper, and it requires professionals to be able to help people understand how to cope with those stresses.
So can physical exercise, jogging, exercising, can it also help?
Self-help. I think they are all parts of the self-help.
Okay.
Like every person is supposed to be able to exercise, at least walking. Okay, these are parts of habits that you're supposed to have: eating well, sleeping well, exercising. So it's part of the self-help part. And if you have a mental health condition and your psychologist believes that as an individual, because of your individual differences, because of the way you are, you need exercise, then you go for it. But when you have the condition, it's a psychotherapist who decides what you do, because they observe you, they look at your difference and how you are different from every other person, and they help you in that line.
Yeah, that's truly insightful. So are there any racial or ethical groups that are more prone to mental illness?
I would say no and yes. Okay. I like to be a little bit controversial, but that is not the fact. Okay. The fact is, mental health has no regard for race, ethics, socioeconomic background. It has not. But however, there were research, going on in some countries where they seem to suggest or postulate that there are certain ethnic groups, okay, usually the minority, okay, who are more prone to developing mental health, but that is not a fact. It's just something that researchers have been speculating. So our answer would be, as professionals, no. It has no regard for race or ethnical group, no.
But it may be specialized. Let's take as an example. In Ghana, we are family oriented. Okay, so once you're separated from the family, then you'll experience some kind of anxiety. But in the places where grandma is not really a problem, where you don't have it, you wouldn't have that causing a mental health issue. So those are some of the issues around the racial, but mental health is it's
not regarded for anyone.
Of anyone.
Exactly.
Once you're a person, you have a biological system, you have a brain, then you are prone to it.
Oh, okay. All right. Thank you very much. We're going on a quick break and we'll be back shortly. Please stay tuned. welcome back. We are still talking about mental health challenges and barriers to treatment in Africa. And before we left off, we were talking about the fact that mental health can affect just everyone and anyone. It's not associated to any racial group or any group of persons. Okay, so Masha, my next question is mental health a chronic disorder? Is it a chronic disorder? Or
okay, thank you. So it actually depends on what it is. There are certain conditions that will not be cured. Okay. So in its sense, it becomes a chronic disorder. But however, they can be managed with medication. They can be managed with therapy for a long time. So that's what I would say. Some do come as a chronic disorder. Yeah, it's a condition. For example, people are born with chromosomal abnormalities. It becomes for the rest of their life. People who are autistic, people who might be having some sort of hyperactivity disorder. You can have medication that will manage it for you, but it becomes part and parcel of your life, so you need to work with it for the rest of your life. So
in the situation where it's a part of your life, it's chronic, you have to live with it. It can be managed.
It can be managed, but it cannot be cured, because it's an external factor. It's part of your genetic makeup. Yeah, so you cannot alter it, but you can manage it. However, those that you acquired, habitually can be cured. So they do not become your chronic illness.
Anything to add to it?
Yes, and those are your habits. If you have a predisposition to a chronic condition, then you could be going towards the chronic side. So the management process is there. You just have to follow the routine and then help your body function as it has to be.
Okay, there's a research out there that says that 90% of people who have attempted suicide have a mental illness.
For statistics, I don't have evidence on the 90%, but what I can tell you, there was a report that was published. It was a 10-year study in the US where they were studying people who were suicidal, who had suicidal ideation and all. What they came out with was that it was a Center for Disease Control in the US, and what they came out with is that 54% of those people who attempted suicide or who died by suicide had no mental health problem. Okay. On the other side, what I can say is that there are many more people who die by suicide, but from other mental health problems. For example, depression is one of the most common ones, and anxiety. Okay. So what we use the term is that you die by suicide. You don't commit suicide. It's not a crime. So you die by suicide, but you have other mental health problems that will aggravate the condition or the desire to end it all in life.
So just because the person thinks, okay, maybe the person went to the hospital and then you're told, okay, you have a little mental issues, then the person commits suicide. That is dying by suicide, right?
You die by suicide, but might not die from suicide. You might be having a mental health problem.
Okay, so it's because of the mental health problem.
Yes, so they go usually hand in hand. Because a lot of mental health problems overlap. So you might be having depression and anxiety. You might be having stress and depression. They work hand in hand. So you need to be careful when diagnosing people with mental health problems. That's what I mentioned to you. It's always an individualist approach, because one may be secondary to the other. So if you take an approach to dealing with a secondary matter and you leave the major thing that becomes a problem or disabling to the person, then you're not doing good for the person. So it's very important in understanding how to deal with mental health problems.
So what then are some of the treatments or barriers to treatment in Africa?
There are many. So psychotherapy is one of them. Okay, so depending on the condition, for example, a cognitive behavioral therapy, it was developed by Beck. So Aaron Beck would feel that this is the best approach to dealing with people, because it affects how you think. So your thoughts affect how you feel today. Your thoughts and your feelings would determine your behavior. So it becomes like a vicious cycle of activity. So in order to break that cycle, you need to help people to change the way they think. When that is done, it helps them to feel better within themselves, and the kind of actions or the consequences of feeling better will change. So this is one of the approaches to help people to deal with mental health problems. The power of the brain is so powerful. So if you're not able to control your thoughts, it's going to take over your feelings and how you behave in particular setting. And among others, there are quite many. So we have a universal standard for most of the therapies. So the therapy used in Ghana will be the same therapy that is being used in the US, in the UK, in the US. It's just that it depends on the condition, not the country. So we all have the same universal standard of using the therapies.
Oh,
yes,
okay,
so across countries, across continents.
Okay.
No.
All right. So I was thinking, the psychology of happiness, is it also a treatment to mental health?
Okay. She keeps having some interesting findings.
So psychology of happiness, as she said earlier, there's a difference between mental health and there's mental illness. Okay, so the psychology of happiness would help both those who have to maintain their health and those who have the illness and have to stay okay. So psychology of happiness,
it's an approach, okay, or it's a technique you use to modify feelings about things or feelings about objects, okay. However, we have something we call positive psychology. It's a whole knowledge on its own. It's a whole therapy on its own.
I'm about to ask that. How different is it from psychology?
Exactly. So having happiness is just an aspect of the positive psychology. See, for every therapy, there are goals and there are aims you need to establish. So having the positive psychology, the aim is not to just make you happy. It's to see things from a more positive light. It's to develop coping skills, you know, to be able to cope with life adversities, with the normal stresses in life. So there is a difference between them. One forms a bigger part of the other, or subset of the other.
So they are different.
They're different.
Just the one is a subset.
One is a subset of the other.
So the happiness is a subset of the positive
psychology. It's a whole concept on its own.
But then they are both treatments, or they kind of help.
Yes, I would say it's some kind of help. So it's not a direct treatment, but it falls under an aspect of a therapy that you would be administering to a client.
So as an individual who is mentally stable, like a mentally stable person, you just have to be happy.
Yes, there are activities you can do to make yourself happy. So you do a list of pleasurable activities, for example. You do like a schedule of things you've never done before. Okay, so you set goals for yourself, or bucket list, as we say. So these are little things you can do to happy yourself. Happy yourself doesn't require much to do. Sometimes you just taking a favorite meal in part of a day, rewarding yourself. So rewarding yourself could be one way of happying yourself. Okay, but that doesn't mean it's a whole therapy on its own. It's just a subset of a bigger therapy. That's what we're trying to say.
And it's a coping skill. Once you stay positive every day, you stay happy every day, you are using that coping skills to help you face the challenges of the day. So you have a stressful day, you just remember one happy moment or one good thing that happened sometime, and you see that you just go smiling, and the problem becomes low or little in your eyes.
So it's a conscious effort,
trying
to make yourself
and
happy.
You must know what makes you happy. What makes me happy? Some people staying in the room makes them happy. Some going out makes them happy. Somebody will say, I don't know what makes me happy. You have to try things to know what makes you happy.
So create a list of things that you think you would enjoy. Then you make it your bucket list. Okay, by 2018, I should have accomplished this. You tick and you clear it. You tick and you clear it.
Okay. So if in a day I haven't been able to make myself happy, I consciously have forgotten about it. What happens? Do I have to consciously try and remember, and then remember some good times and smile? That is just it.
The good thing is that when you are down, you know, you just know. So when you are down and you recognize that you are down, then you start the conscious process. And as the day goes by, happy things happen to us. So you go home and then your dog is jumping at you, licking your feet. It's when you focus on that, there's a good feeling that comes with it. Okay. So those who have dogs know how that makes them feel. There are people around you are very angry, but there are people around you smiling, saying funny things. You should be able to tap into that and then see the happiness that comes from it. So it's more of a perspective also. Your perspective of things will affect how you see things.
Talking about treatment, we talked earlier about prayer camps, but my view is there are prayer camps where you go and then they pray for you and then sometimes you get healed. Okay? But then there are others where you go and then they are chained, they are being beaten, they are treated like they are not humans. So what happens to such maybe churches or wherever they find themselves where they are being chained and stuff like, even in the psychiatric hospitals, I hear some of them are being chained and stuff like that. So what happens if you go to church and you're being prayed for and you come back to your senses? That one needs no form of treatment again if you find that the person is okay. If the person is your family member, maybe you took the person to church, the person has been prayed for, you feel like standing from afar, you feel the person is okay now. The person doesn't need any form of psychological treatment again. Is that it?
It doesn't work exactly like that. Okay. What I can say is that, for example, epilepsy. Okay. It's a brain problem. Okay, where the neurons don't transmit the way they should. I will not go much into electrical impulses and all that, but before, epilepsy was considered to be a witchcraft. Okay, so it takes time for people to understand that it's a medical condition that requires medication and can be managed, and people will actually get better with time. So I think the perspective of people going to churches to get healed and all sort of things, I think it's a personal decision upon the people. But what kind of help are you expecting to get from a spiritual leader? Okay, we have people who are professionals, we have people who are qualified, people who are not. So do you have that spiritual insight to know the person you are going to see is going to be the right help? Because a lot of leaders in spiritual circle, okay, have actually done more harm than good to people with mental health problems. And I have actually personally seen clients who have gone to churches and they were told all sort of things, and these people required immediate psychological help, and they refused to do that because their pastor said so, their church members said so. So having a spiritual connotation to psychological problems, it's a very dicey topic, and I might be stepping on people's toes in terms of religion, but what I want to say is that you need to understand that mental health has nothing to do with your spirituality. Okay, being spiritual and seeking spiritual health might seem to be like an enhancer or a coping skill for you, okay, where you can get some sort of relief of certain things, but spiritually you can't heal a mental problem unless you have that sort of faith. Okay, now people are being chained in such places. What do we do about it? Do we also accept the fact that somebody with mental health problems should be chained? Is it because our relatives are not part? That's why we are not doing that. You see, so things like this, it's a topic that has been happening over, I think BBC even did a video documentary on such where people were chained and all sort of, it's unethical. Okay, so such people practicing such, we need to stop such people, we need to report such people, because you cannot change somebody with a mental health problem. Okay, so I think that's my perspective on spirituality and psychology. So seeking spiritual help, it's an individual choice, but people need to ask themselves, is that the right place to seek for psychological help? Because if you understand what mental health is, I don't believe people will be going to a pastor, because when you have malaria, the first place you're going is a medical doctor. So when you have a psychological problem, you should see a licensed and a professional psychologist. Okay, going to church, no one is against going to church. Okay, none of us here is an atheist, and none of us are saying we shouldn't go to church, but you need to know where to seek help at the right place. Even in the Bible, it says, ask and it shall be given. So ask for the wisdom, for the insight to know where you need to go. You'll be directed to the right place.
Okay. And it's not that we want to take it away from you. We understand as being part of Africa. Spirituality is part of Africa. You can't take it from them. There's not much you can do about it. We are giving you another option. We are scientifically telling you that mental health is a biological, it has biological causes too. So once you're seeing the spiritualist, see one who understands your biology, so that they will be able to help you in that line, because you are chaining the person because you can't hold them down, and the doctor has a way of bringing them down. Why don't you just go to the doctor first, bring the person down, go to church, continue praying, still make the person see the doctor, because it's God that gives knowledge to all men. Okay, so God has given a medical doctor knowledge. He has given the psychologist the knowledge to be able to understand that this is how the brain works. This is how it would behave if I do this to it in a particular way. Okay. So we are not taking away from you that don't go to church. When you come to the hospital, don't go to church again. Don't send the person to the hospital. Yes, it's good for the person to pray, but the psychologist will teach you some things that you shouldn't do when you have a mental health condition, like going for all nights. You be staying up the whole night when you're supposed to be taking medication and sleeping. Okay, so some things jumping too much depending on the person. Okay, so there are some things that trigger the conditions that when you come to a psychologist you'll be able to understand. And as we said before, knowledge is everything. The way if you have the knowledge about these things, you don't really have a problem understanding it.
So we've been talking about mental health and we're going on a quick break. We'll be back shortly. Please stay tuned. Welcome back to HealthAfrik on AAE TV. We've been talking about mental health challenges and barriers to treatment in Africa. So Masha, and my very last question for today is, as there's suffering in the world, how can we justify devoting time and resources to positive psychology?
How can we? It's a collaborative effort, okay? So we need to come together, to work together. So we have people with private entities, we have governmental institutions who should liaise with Ghana Psychology Council. We should also collaborate with psychological associations to help people get the professionals, to give them the consultations, to give them the projects that people can involve. You know, corporate institutions, for example, what they can do is to organize seminars for their staff. You know, to do screening for their staff regularly, being it quarterly, being it monthly, you know, also taking their families, because these people go through a lot of stress, okay, being it at work, being it at home. So first of all, what you can do is to have a collaborative effort to attain that goal of whipping up the interest of mental health, also reducing the stigma attached to mental health. And all this will go a long way to help in development of positive psychology, because it's a subset of entire mental health. Another thing what we can do is to have more platforms like this to engage people, to educate people on the need to take good care of themselves, to understand there's a difference between mental health, to understand there's a difference between mental health illness. We have various mental illnesses, and there are over 300. So we need to take note of each one of them. We need to start taking this from childhood. You know, we need to train our children. We need to help the youth, especially because they are the more prone prone group of people or at risk for developing mental health problems. And I think starting from there, we can go a longer way to develop that resilience among people to mental health problems.
And on that, I believe that Ghana has an education system and it groups children at a particular place. So when you teach especially teenagers about what mental health is, they can better understand it, and as they grow, we get a good resource for Ghana. So the Ghana Education Service can look at this, putting psychology into the education system and making it a point that students would understand this. So even let's take the university as an example. Undergraduates can take psychology in everyday living, level 100, you know, so that they get to understand their self, and then they bring out their own potentials. These are some of the things that we don't have in Africa, and it's really disturbing us. Especially we have self-identity issues. You want to be like somebody else. It's a whole package on its own. Africans should start accepting who they are, accept that this is what I can make, this is how I make it, and it's different and it's unique. But you think you want to be like somebody else, and it's a whole psychology topic.
Identity crisis.
Identity crisis.
Okay, so talking about involving the study of psychology in schools, I remember way back in university, we all studied psychology, but it wasn't trying to identify with yourself. It was book, you know, it was like olden facts, or you had to learn about someone, like, come on, what has it got to do with psychology? We didn't get it, so I didn't even pay attention to it. So how will it help?
Okay, I think it's the aims. If they focus more on helping potentials, then it will change the direction. So if you are going to put it in the system, then you should get the psychologist, the educational psychologist involved, so they would help you know the model you should give to the students and help them in the process.
Yes, based on their developmental stages.
Oh, okay. Okay, so what will be your final words since you are wrapping up?
First of all, of course, thank you for having us here today. It was a pleasure meeting you and also having this discussion. I think the final word what we can do is like there's a need to have more discussions on mental health. Mental health is very important. It's your total well-being, you know, both your emotional, psychological, physical. So without mental health, there are a lot of things we can't do. We shorten our lifespan by having mental health crisis. We are not happy with life. We are not satisfied with life when we have mental health problems. So it's important to have more discussions like this. It's also important to engage licensed and professionals, under the Ghana Psychology Council, to have people give the right advice, to give the right interventions to people, because there are a lot of people in the system who are not qualified to do that job. That is also another problem. And 3 is that you need to take care of yourself. Eat well, sleep well, have positive relationship, have a break in your life. It's not always about work. As they say, no work and play makes what all of us very dull. Okay, so it's very important to take care of yourself, I think, on this note.
All right. Georgina?
And my last words will be to the spiritual leaders. I mean, knowledge is everything. They should get knowledge. And Bible says that you should have knowledge, and in all your get understanding. Okay, so you are dealing with a group of people, thousands of people, and they all have mental states. Okay, so you should be able to understand that even if the person has anger issues, it will destroy your own church. And you don't know how to handle the anger issues. Some anger issues are habits. Some people have learned how to be angry and how to destroy things. Okay, it's not always the demon who is doing it. Some people do it intentionally. Okay, so when you are registered with a council as a pastor, and then they send you through trainings and you understand these things, then you'll be able to relate to your people better and have your church guarded to a particular place.
All right, this has been an interesting and insightful show. Thank you very much, Masha and Georgina, for honoring our invitation and coming here. It's been very great having you on the show. We've been talking about mental health challenges and barriers to treatment in Africa. Thank you very much for staying with us. Our final words has been to the pastors. Please try and register with the council, go through teachings, go through courses, and know how to deal with your members. And then as a personal, as an individual person, take care of yourself, eat well, love yourself, and exercise. It also helps with mental issues. Thank you very much. I am your regular host, Bridget Denteh. Thank you.